Imagine you can sleep deeply all night long, no longer startled by sudden cramps. No more tightness in your calves or lingering pain that lasts through the night. Instead, there is lightness, stability, and a morning that begins with strong, flexible legs. If you want to stay active, live independently, and confidently take control of your body, the key is supplement the right type of vitamin. So, in today's video, we will reveal to you top 7 vitamins and minerals that help keep your legs healthy and prevent cramps, even when you're over 60. In the next 10 seconds, we will explore the most important vitamin for leg health, but most seniors are deficient in it. Before we start, don't forget to hit like, subscribe to the channel, and turn on the notification bell so you won't miss any health tips from Senior Health 360. We help you strengthen your leg and lead an active life every day. Let's get started right now. First is vitamin D. When we enter old age, bone density and muscle mass begin to silently decline. Tasks that were once easy, like getting up from a chair or walking around the house, suddenly become more difficult. Part of the reason is that bones become brittle and weak, and the concerning thing is that vitamin D deficiency is often the overlooked factor in that decline. Vitamin D is not only related to bones, it directly affects motor function, balance ability, and leg strength. However, why do most seniors frequently lack this important vitamin? After the age of 60, the ability to absorb vitamin D from natural sunlight begins to decline significantly, partly due to aging skin, which no longer synthesizes vitamin D as effectively as before. Even worse, many seniors avoid going outside as much as before due to lifestyle changes, difficulty moving around, or fear of skin damage. What are the consequences? The muscles gradually weaken, the muscle mass shrinks, the legs become shaky and lose strength. Therefore, adequate vitamin D supplementation is the key to maintaining stable legs and improving mobility. The role of vitamin D goes beyond what many people used to think. This is not just a vitamin good for bones, but also a powerful ally that helps your muscles, especially your legs, function flexibly, strongly, and stably. Vitamin D helps transmit signals between nerves and muscles, while also supporting the protein synthesis process, a key factor in preventing muscle atrophy and weakness. You can think of vitamin D as the coordinator that makes your leg muscles respond more nimbly with each step. If you lack it, your legs will no longer be flexible, prone to trembling, sluggish, and out of control. This vitamin is also particularly essential for maintaining fast-twitch muscle fibers. Those fibers that help you keep your balance and react promptly when you miss a step, slip, or get up from a chair. When these fibers weaken, the risk of falling increases. Not only that, vitamin D also helps reduce inflammation in muscle tissues, providing significant relief for those who frequently experience dull pain, joint stiffness, or nighttime cramps without any clear reason. The unfortunate thing is that many seniors are silently deficient in vitamin D without even realizing it. And the consequences are not just weak legs, but also a decline in overall health, loss of mobility, and a decrease in quality of life day by day. Optimizing vitamin D levels can bring significant relief to those who frequently experience leg cramps, joint stiffness, or unexplained pain. It may sound surprising, but neglecting vitamin D deficiency can lead to many serious health consequences, not just weak legs. When the body doesn't have enough vitamin D to absorb calcium, bones become fragile and more prone to fractures than ever. And just a slight fall can make you face a fracture or loss of the ability to walk independently. Not stopping there, vitamin D deficiency is also linked to a weakened immune system, poor memory, and an increased risk of cardiovascular disease. For seniors, vitamin D deficiency can also lead to prolonged leg weakness and a higher risk of chronic diseases. So is there a way to fix this? You can completely improve this condition in a simple and natural way. Just spend 15 to 30 minutes each day sunbathing lightly in the morning or afternoon, exposing your arms and legs, and your body will start producing valuable vitamin D without the need for medication. But if you go out less, have an unbalanced diet, or are taking many medications, vitamin D supplements are a necessary option. Most experts recommend about 800 to 1,000 IU per day to support the proper functioning of muscles and bones. In addition, don't forget to include vitamin D-rich foods such as salmon, mackerel, fortified milk, eggs, and mushrooms in your daily diet. And to be sure, you can definitely do a simple blood test to know exactly whether you are deficient in vitamin D or not. Be proactive starting today, because if the deficiency persists, you won't just have weak legs, but you'll also be prone to falls and osteoporosis. Take care of your vitamin D levels starting today to enjoy a more independent, flexible, and healthier life every day. Next, there is a very important nutrient that is often overlooked when discussing the strength of the legs. That is vitamin B12. Few people know that for our nervous system to function smoothly, it must have enough B12. This vitamin acts like a messenger that helps signals from the brain travel down the spinal cord to the leg muscles, transmitted powerfully and accurately. When B12 is deficient, these signals become disrupted, causing the leg muscles to weaken, making it easier to lose balance and increasingly difficult to control movement. Legs feel heavy and exhausted, often accompanied by tingling or numbness, which is one of the most common symptoms of vitamin B12 deficiency, so this should come as no surprise. But what's noteworthy is that vitamin B12 deficiency is very common among seniors. Unlike many other vitamins, B12 is not easily absorbed. To absorb it from food, the body needs sufficient stomach acid and a special protein called intrinsic factor. However, as we age, the stomach secretes less acid, making the absorption of B12 increasingly difficult. Those with gastritis, acid reflux, or those who use antacids long-term are even more likely to be deficient. Therefore, even with a sufficient diet, the body may still not receive the necessary amount of B12. What is more concerning is that the diet of seniors is low in B12-rich foods. Many seniors have simple diets with little meat and fish. This causes the B12 levels in their bodies to gradually decrease over time without them realizing it. Feeling tired and having weak legs are just the initial signs. If B12 deficiency persists, the nervous system can be damaged, affecting reflexes, balance, and coordination when moving. Many seniors have difficulty walking due to a lack of B12, are prone to tripping and falling, or simply find their legs are no longer as agile as before. It doesn't stop there. Worse yet, the decline is often so subtle that people just accept it as a natural aspect of aging, even though it is entirely avoidable. Restoring B12 levels can significantly impact energy and movement, which is great news. When seniors address their weaknesses, research shows that their strength, endurance, and leg function all improve significantly. So where does vitamin B12 come from? Unlike many other nutrients, vitamin B12 is almost exclusively found in animal-based foods. Rich sources of B12 include lean meat, seafood, eggs, milk, especially clams and liver, which are very good for health. For those who eat little meat or fish, or follow a vegetarian diet, supplementing B12 through fortified cereals, fortified plant-based milk, or B12 tablets is very necessary, especially when the ability to absorb it through the digestive system decreases with age. Vitamin B12 is one of the safest vitamins to supplement, as excess amounts will be excreted through urine. For seniors, especially those who have difficulty absorbing B12 from food, taking supplements or receiving regular B12 injections can yield significant results. Maintaining stable B12 levels not only helps prevent the gradual weakening of the legs over time, but can also prevent many other neurological issues. A simple blood test is enough to check the B12 levels in the body, and the most important thing to remember is healthy legs are not just about being able to walk, but also depend on the nerves transmitting signals accurately, reacting quickly, and coordinating well. If there is a lack of vitamin B12, exercises will also be difficult to be effective because the nervous system does not function properly. Therefore, ensuring adequate vitamin B12 is one of the most effective and simplest ways to help seniors maintain their mobility, independence, and live healthily every day. Thirdly, calcium is a key factor that helps bones stay strong and muscles operate smoothly. In young people, bones are continuously regenerated and strengthened thanks to the abundant calcium that the body absorbs well. But when entering the age of 60 and beyond, the ability to absorb calcium decreases and bone mass gradually diminishes, making bones fragile and prone to fractures. Calcium not only helps bones stay strong, but also plays an important role in muscle control. Every step, every time you stand up from a chair, calcium is needed to activate muscle contraction. Calcium deficiency can cause cramps, muscle weakness, or insufficient leg strength to maintain balance, leading to slow movement, easy fatigue, and instability. So how can we ensure that the body has enough calcium? Dairy products such as milk, yogurt, and cheese are very good sources of calcium. However, it's not just that. Sardines, almonds, bok choy, kale, leafy greens, tofu, and calcium-fortified plant milk are also very nutrient-rich. It is important to eat a variety of foods to help the body absorb calcium consistently and effectively. For those with poor absorption or limited diets, supplementing calcium through tablets, especially when combined with vitamin D, can yield significant results. However, more is not always better. Drinking too much calcium, especially from supplements, can cause bloating, kidney stones, or arteriosclerosis. The recommended daily intake of calcium for people over 60 years old is 1,000 to 1,200 milligrams, which should be evenly distributed from food and supplements if necessary. Besides diet, exercise is also a key factor for calcium to be effective. Simple exercises like walking, endurance training, or even gentle jogging will help calcium reach the areas of the body that need it most, the bones and muscles. On the contrary, if you don't exercise, even if you supplement with a lot of calcium, it won't help strengthen your bones. A lack of calcium not only weakens bones, but also gradually reduces the mobility of seniors, leading to a loss of independence and self-sufficiency. On the contrary, when you have enough calcium combined with appropriate exercise, you can maintain a more active, stable, and healthier life every day. Do you often experience leg cramps at night? Do you feel your calves stiffening with sharp pain, disrupting your sleep and making your mornings exhausting? That could be a sign that your body is lacking magnesium, an essential but often overlooked mineral. Magnesium helps muscles contract smoothly every time you walk, stand up, or climb stairs. It also helps the body maintain endurance, reduce fatigue, and prevent sudden cramps. When there is a magnesium deficiency, muscles cannot relax properly, leading to cramps, aches, and restless leg syndrome, which is very common in seniors, and many people do not know the real cause. Besides its role with muscles, magnesium also has a significant impact on bones and joints. Although calcium is often considered the star in bone protection, magnesium is the mineral that helps calcium get to the right place, into the bones, rather than being deposited in soft tissues where it can cause pain, inflammation, or joint stiffness. Long-term magnesium deficiency also increases the risk of osteoporosis and fractures in seniors. What's noteworthy is that many seniors are deficient in magnesium without even realizing it. The reason is due to age, stress, a diet lacking in vegetables and nuts, along with the use of diuretics, stomach medications, or blood pressure medications, all of which rapidly deplete magnesium. This silent deficiency gradually weakens the body, making it difficult for you to walk for long periods, climb stairs more slowly, and easily become exhausted even with light activity. The good news is, properly supplementing magnesium can bring about significant improvement. Just after a short period, many people felt their legs lighter, cramps significantly reduced, slept better, and regained a sense of comfort when moving. You can supplement magnesium through foods such as black beans, spinach, avocados, pumpkin seeds, almonds, and leafy greens. For those who have difficulty absorbing it, magnesium in pill form, especially magnesium citrate or magnesium glycinate, is a more easily absorbed and effective option. When magnesium levels in the body are restored, you will notice your legs reacting more nimbly, standing more steadily, and significantly reducing symptoms like cramps or muscle stiffness. Magnesium also helps improve balance and coordination, reducing the risk of falls, which is extremely important for the health and independence of seniors. Next, potassium, the silent mineral but essential for the health of your legs. Imagine you just got out of bed in the morning and suddenly you have a severe cramp in your calf. The sharp, cramping pain makes you unable to move. Have you ever experienced this? That could be a sign that the body is lacking potassium. This mineral plays a role in maintaining fluid balance inside and outside the cells, essential for muscles to function smoothly. When potassium levels in the body drop, cramps and sudden muscle spasms are more likely to occur, especially in seniors, those who already have issues like poor circulation or reduced muscle mass. But that's just the surface. Many people, after standing for a while, will feel their legs tremble, become unsteady or stiffen, making it difficult to walk. The reason is that potassium helps transmit signals from the brain to the leg muscles. If there is a lack of potassium, these signals are sent slowly or inaccurately, leading to feelings of weakness, trembling, or difficulty lifting the legs. increasing the risk of falling, something anyone at this age wants to avoid. Not only does potassium help muscles function well, but it also keeps bones strong. Few people know that potassium helps neutralize acidic substances in the body. This contributes to preventing bone loss and osteoporosis over time. A diet rich in potassium not only strengthens bones, but also keeps the knees and ankles flexible. So how can we ensure that our bodies get enough potassium every day? Nature has gifted us with many potassium-rich and easy-to-eat foods. Bananas are a familiar name, but you can also get more potassium from baked potatoes, with or without skin, avocados, spinach, beans, oranges, and sweet potatoes. Incorporating these foods into your daily meals will help keep your muscles and bones in a stable condition. For some people who have difficulty absorbing potassium through food, doctors may recommend using supplements. However, supplementation needs to be monitored, especially if you have conditions such as kidney disease, high blood pressure, or electrolyte disorders. Regarding the requirements, adult men need about 3,400 milligrams of potassium per day, while women need about 2,600 milligrams per day. A balanced diet, rich in vegetables and fruits, is usually sufficient to meet this requirement. We often hear a lot about calcium and vitamin D when it comes to strong bones and healthy joints. But what few people know is that both of these nutrients cannot function effectively without vitamin K. And the surprising thing is, this is the crucial piece that many people are overlooking. Imagine, instead of being directed to the bones to reinforce their structure, calcium without vitamin K goes astray, accumulating in blood vessels or soft tissues, where it can cause joint stiffness, pain, and hinder blood circulation. But when vitamin K is present, everything is guided in the right direction. Calcium is brought back home to the bones, making them stronger and healthier every day. This is especially important for seniors, as many studies have shown those who consume a lot of vitamin K have thicker, healthier bones and fewer fractures. Vitamin K activates osteocalcin, a type of protein that helps bind calcium to the matrix of bones, like a silent worker building a solid foundation for your skeletal frame. And it doesn't stop there. Vitamin K not only helps strengthen bones, but also keeps joints flexible and muscles functioning smoothly. Your legs want to be sturdy not only need strong bones, but also flexible joints and strong muscles. That's why vitamin K helps reduce knee pain, alleviate joint stiffness, and soothe chronic inflammation, a persistent suffering for many seniors. If you've ever found it hard to stand up after sitting for a long time, or noticed your legs getting significantly weaker after a squat, you might be seriously deficient in vitamin K. And when the muscles are weak and the joints are not flexible enough, the risk of falling increases, leading to a series of unwanted consequences. But fortunately, that can be completely improved. Let food be your natural medicine. Vitamin K1, the more common type, is abundant in leafy green vegetables such as spinach, kale, Brussels sprouts, and Swiss chard. Meanwhile, vitamin K2, considered to be stronger, is found in fermented foods such as annatto, fermented soybeans, aged cheese, liver, and egg yolks. Just one serving of green vegetables each day, a smoothie or a plate of stir-fried greens, is enough to make a lasting difference. However, if your digestive system is no longer absorbing well as before, or you are taking antibiotics for an extended period, Supplementing with vitamin K through pills might be a suitable option, but remember, before starting to take it, especially if you are using blood thinners like warfarin, you should consult a doctor to ensure absolute safety, because in the end, healthy legs not only help you move around easily, it helps you maintain your independence, freedom of movement, and the quality of life you deserve. And sometimes just adding a little vitamin K each day, you can walk more confidently and steadily, regardless of age. Finally, we want to mention vitamin B6. Many people do not realize that vitamin B6, scientific name, pyridoxine, plays an extremely important role in maintaining the health of muscles and legs. Although there are many nutrients that support movement, vitamin B6 is particularly essential for the stable functioning of nerves, muscle recovery, and the ability to use protein to maintain muscle mass. Even muscles that were once strong can gradually atrophy if lacking B6, making simple movements like getting up from a chair or stepping up a stair an unexpected challenge. Vitamin B6 acts as a conductor that helps nerve signals be sent accurately and quickly. Without it, signals can be delayed or misdirected, leading to sensations of numbness, tingling, slight tremors, or even mild muscle control loss, which many seniors often mistake for symptoms of aging. Not only that, vitamin B6 also helps reduce muscle fatigue caused by chronic inflammation, a common issue among seniors. Thanks to its ability to reduce pain, increase flexibility, and improve recovery after exercise, B6 is considered a silent ally for your legs. If you often experience muscle stiffness, persistent fatigue, or very slow recovery after light exercise, adding more vitamin B6 could make a significant difference. In addition, B6 also supports the production of red blood cells, the cells that help transport oxygen to the muscles. When hemoglobin levels are low, muscles do not receive enough oxygen, and you will quickly feel tired, heavy, and experience reduced endurance even after a short period of activity. Fortunately, vitamin B6 is present in many familiar foods. You can find B6 in chicken, salmon, tuna, bananas, potatoes, chickpeas, and fortified cereals. Just by incorporating these foods into your daily meals, you can naturally supplement the necessary amount of B6 for your body, supporting both nerve function and muscle strength. For some people with digestive issues or restricted diets, supplementing with vitamin B6 in pill form may be necessary. Seniors typically need about 1.5 milligrams per day for women and 1.7 milligrams per day for men, but these numbers can vary depending on individual health and age. However, it should also be noted, supplementing with B6 from food is safe, but taking high doses continuously over a long period can affect the nervous system. Therefore, the best strategy remains maintaining a diverse, balanced diet rich in foods containing vitamin B6 to provide a steady supply without the risk. As you have seen, by simply supplementing the right essential vitamins, you can completely slow down the process of leg weakness, reduce cramps, improve balance, and regain flexibility every day without the need for complex or expensive methods. Remember, the health of your feet is the foundation for independence, freedom, and quality of life in retirement. And the wonderful thing is, you can start taking care of your feet right from your daily meals. If you find this video useful, don't forget to hit like to let us know you're interested in this topic. And to not miss important health information specifically for seniors, please subscribe to the channel and turn on the notification bell. If you have any questions, comments, or suggestions for the next topic, please leave a comment below. We are always listening. Thank you for taking the time to watch. See you in the next video.